Personnel Committee meeting for May 19th. Councilmember Zine presiding. Mr. Koretz and Mr. Parks en route?
I'm hoping.
We're hoping. Okay, well, we will begin. Since we have 7 items and 6 of them involve the Department of Water and Power. So we will start, and I guess we can consolidate 1 through 6 if I'm not mistaken. We can take 1 through 6 at the same time? Okay, let's do that. So why don't you, Madam Clerk, go 1 through 6.
Items 1 through 6 deal with various contracts for medical and dental plans for Department of Water and Power employees.
Michelle Hagan, Department of Water and Power.
Caroline McKnight, Department of Water and Power.
We're here before you today to request your approval of our contracts that we have, the 6 that we have listed on the agenda. The reason that we're here today is because we do not go out for bid, as these contracts, these healthcare providers are embedded in our contracts, and therefore these are the providers that we must use based on our contract. And so we're asking for your support and your approval.
Why don't we go out for bid?
Hi, I'm calling from
In
Personnel
order for us to
Committee.
go out for bid, we have to enter into negotiations with the labor organizations and remove the existing healthcare providers out of the contract or add additional ones.
And is there an increase in rates to the department or for the,
Our subsidy is at the Kaiser family rate. Are you talking about our subsidy? Our
Yes.
subsidy would be at the Kaiser family rate.
is that the same as last year or has that gone up?
It's a little bit more, 3%
How-
more.
3% increase?
Yeah. Right now, the subsidy is at $1,230.27 per month. We have made we have not increased the benefit level at all in any of the contracts.
So the rate went up 3%. Is there any increase for the employees? Or is the fully subsidized by the department?
We only subsidize up to the Kaiser family rate, which is at $1,230.27. So if they're in the Kaiser family rate, we fully subsidize. If they're in another plan that is more than that, they would pay the difference between the subsidy and whatever the healthcare tier is.
Tom, how does that compare to other plans we have for other units?
The Kaiser subsidy for the current plan year for the civilian workers is $1,060 per month.
1,060? And then what about the increase of 3%? What's the increase that we're seeing on the other side?
At the moment, we do not have final rates for plan year 2011, which will start on January 1st, but at the moment, the proposed Kaiser increase is 8.5%.
Okay, so how come Water and Power is getting a better rate? 3% versus 8.5%. It's the same, like, plans comparable? Compatible?
Well, the fact that they're at 1,200 and we're at 1,000, no, the plans are not comparable.
So do they,
In terms of benefit design, their plan has, there are differences in the plan design that would account for the difference in the basic premium price. In terms of the rate increase, why they're receiving a 3%, I don't have any information on that. In terms of normally, you would see a rate increase based upon a couple of factors. One, the utilization of the plan. Their plan may be doing better in terms of utilization than ours is at the moment. Last year was a particularly bad year for us in terms of utilization. And then it's dependent upon the demographics of the group. I don't know what the demographics of the Water and Power group are, whether they're getting younger and therefore potentially less expensive, or whether they're getting older and therefore.
well, looking at them, I don't see them getting younger.
Well,
No, they're all mature adults. Nobody gets younger working for the city of Los Angeles.
Well, you know, the question is,
Right, Zena?
you know, they have expanded their workforce, and whether in that expansion they've managed to acquire a slightly lower demographic or not, I don't know.
But I'd like to see, because we have to provide health care to our employees, whether they're with the Water and Power or other city departments, police and fire. And if some are going up 8.5% versus 3%, and they're all working for the city of Los Angeles, well, it's a different department. What about the airport? What about the harbor? we need to be fair to our employees and also fair to the taxpayers who are ultimately paying these bills. I don't have any problem with what they have for the Department of Water and Power. I think that this is a one-year plan.
Yes, it is.
In the future, hopefully they have some competitive bidding. They lock them into the contract, but the fact is, if you got a 3% increase compared to the 8.5%, it's advantageous for water and power, but that doesn't speak well for the other city employees, where there's gonna be an 8.5% increase with the additional drain on the budget. So that's something that we can deal with. But somehow.
We don't have the opportunity to deal with these specific plans because these specific plans are embedded in their labor agreements, as was indicated in those.
Yeah, but we approve those labor agreements. Those labor agreements
Those
come for
labor
approval.
agreements don't expire until 2000 and.
It's a 5-year contract, wasn't it?
14, yeah.
14 is the.
Now that does not preclude the department and the CAO's office at the direction of the ERC from going and looking at the plan design issues, which drive the subsidy.
Well, I think we ought to do something for the benefit of the municipal workers, because if you've got that type of spread, 8.5 compared to 3,
But you also have a spread between 1,060 and 1,230. So
well, I didn't want to mention that. That adds more salt on the wound. So if their subsidy is greater, their increase is smaller than what we're providing for other municipal employees. So so you've got Kaiser, Blue Shield,
Pacific Care.
Pacific.
Healthcare Plan of Nevada.
Okay, we have Kaiser and
Blue Cross,
that's it?
yes.
How come we've never ventured into these other plans?
Because on the city side, on the civilian side, we routinely send these plans out to bid so that we have bids from the other health plans, Blue Shields, the Pacific Care, United Health in the past, and Blue Cross provided, at the time we had the RFP out, the absolute best product for the price.
We're talking about 1 through 6, the health plans for the Department of Water and Power employees, and the increase is 3% for the water and power. The increase for civilian plans for other municipal employees, 8.5%. The subsidy is $1,230 for them, and for the rest of the city employees on the other plans, $1,060. So I'm trying to determine why their plan has a smaller increase, better benefit, and ours for the other city employees is 8.5 and $1,060. So there's quite a spread.
Because they're spending our 20 million.
Oh, they're spending the 20 million. And it's embedded in the contract, so next year you won't go out for bid either. You'll continue with the same process?
With the same process unless the contract language is changed.
Well, they have a multi-year contract, and this is embedded in that,
Yeah.
so it's not a separate negotiation.
I was just wondering, and this is something that personnel went through a year or so ago, is that the cost containment issue, because that's the real issue. We just found out, I think, yesterday, that for 10 years we've had, health insurance is going up 100%, roughly 10% per year. And there's a lot of reasons for it, but when you figure between 30-some-odd thousand employees in the city and then whatever Water and Power has and Harbor and all that other, it looks like some of these rates are almost as if you're buying a plan on your own. I mean, it's very, the benefit of having large numbers of people and paying these rates that are guaranteed. It's not like they're chasing us down. We pay them July of each year. It just looks like the rate increases are significant. I mean, and let me ask, no secrets from EERC, wasn't there something discussed about having a meeting coming up soon with the insurance companies and the city?
We
about
are,
cost containment?
on the civilian side, we're meeting with the Joint Labor Management Benefits Committee tomorrow. The We've asked the carriers to come in to discuss their proposed rate increases. They are proposed, as I said, the proposed increase for Kaiser is 8.5. Will it stay at 8.5? I don't know at this point in time. I mean, we're still probably 2 or 3 weeks away from final rates. The objective is clearly to get the rate of increase reduced, but the rate of increase is driven by the usage. And last year's usage was terrible on the Blue Cross side. It was not good on the Kaiser side.
So when you say that, you mean, what did you say? We used it more than our funds that we put into it?
Yeah, in terms of, for last year on the Blue Cross plan, Blue Cross paid out more in claims costs than we actually paid Blue Cross. So we have more claims than we have costs. So we went into and through the reserves for the Blue Cross plan. So as Blue Cross comes up for renewal this year, we need to determine whether this year was an abnormal year in terms of utilization or not, or whether it's, is this our new normal? If this is our new normal, then we're going to have higher claims costs in the future. And then we do need to rebuild the reserve.
But how do our claims costs compare to water and power? How can we analyze that?
We would need to contact their plan consultant and have our plan consultant, and then go through the utilization of each plan.
Because when you go to Kaiser, whether you're...
The fact that they're at 1230 is either an indication of one of two possibilities. Either the plan design is richer and therefore more expensive, or their utilization is worse than ours.
Worse than ours or better than ours?
Worse, because it drives the higher price.
Higher price. So it's one of the two. Ms. Lyons, let me ask you, before we went out for the plans for personnel department, I think we did a RFQ to ask the providers, what are all the new things that we should be thinking about before we put it into the RFP? Now, what were some of the things they recommended, and what did we put into the RFP?
Primarily, we were concerned about the wellness programs, to get at the types of programs that they would offer in the RFP to drive down costs. And we do have some pilot programs that were beginning in July for wellness programs, whereby gift cards and walking programs and a variety of programs will be offered by both Blue Cross and Kaiser. And once we see what the results are, we'll know how much further to take that.
So they've included those elements in the current contract?
That is correct.
But now it's voluntary to sign up for any of them?
It's voluntary for city employees to sign up.
There's no incentive as it relates to the number of people that might sign up, on the sense of an incentive is the fee would go down, or how does it?
As I understand it, that's the primary incentive, is that we would get usage down.
Yeah,
Usage down, but, and that
Overall
then would be usage down, then cost.
Cost down, correct.
Okay.
in the plan design at the moment, the wellness concepts are positive incentive concepts, so that you incent the people the employees to a better health care outcome. In the emerging trend in the private sector, you see the opposite side of the equation being used, which is sticks, in terms of negatively incentivizing, or in other words, penalizing people for bad behaviors. So on private health plans today, you'll see if you're a smoker, for example, they charge you more in premium. And so you look at the health care of the individual, and there's a movement, and it's fraught with legal issues, but there is a movement to actually penalize people for their health care situation on what you consider the lifestyle issues, which would be smoking and obesity and those types of things.
Does Water and Power have health programs, gym membership, et cetera, that's paid for by the department through the health?
More than the health fitness center, we actually have a wellness program, and it involves some of the things that Tom just mentioned. We've which is more specific to what I would describe as areas where there's high utilization of services so that we can determine what's the cause of that, so then we can focus our wellness programs on those profit areas.
So that may have some impact on the rates.
Utilization and our rates ultimately.
Mr. Koretz has now joined us along with
Yes,
Mr. Parks.
is it your trend line also that over the last 10 years, you've doubled in cost?
We're doing 1 through 6.
We double what?
Doubled in cost, because that's what the city's trend line is.
I don't believe we doubled in cost. I mean, it's risen, obviously, but in the 10 years that I've been with the department, I believe it's gone up, I want to say maybe 30%, not double.
30%?
20%,
In 10 years?
yeah. I mean,
See, there's a big,
I think it was like well. No, not, I'm talking about the overall healthcare of all programs, not just the one.
Because the trend line for us is 10% a year for a decade. And
Are you
so,
talking about the monthly cost?
no, we're talking about our annual for the city,
annual,
For the whole city?
city,
city employees,
I would
civilian.
have to get the figure to
Yeah.
you, but I don't have it with me, but it's not double.
See, every year, 10%, 10%.
10 years.
So it's a 100% increase from what it was 10 years ago. That's the concern we have.
Yeah.
How do we bring that down?
yeah. And I don't think it's sustainable to keep going as we're going. I mean, it's, at some point, the system's gonna be broken. And so that's why cost containment, and again, I think one of the first things people talk about is raising the copay, and you said, well, if you go too excessive, that then sends a message, do not use the preventive part of it. So there's a balance in there, but the cost is just overwhelming. And we were talking about it yesterday, that our workforce, to be polite, is not healthy. So therefore, it just keeps driving up the system. We have a group that waits until they're really seriously ill and then go to the doctor, or you have those that use the emergency room as their doctor. But the whole issue of obesity and diabetes and all those things are running through our workforce, just like general society. And so the medical plans are just taking a beating across the board. But I'd like to see what the issue of the overall cost trend line for DWP, because if it's remarkably different than the city, then I think there's some issues trying to figure out why and the cost and those things that as we make comparative analysis.
And what about LAX and Harbor? Are they in similar plans?
They're in the city's plan.
So there's the water and power plan, then there's the city plan, then there's the police, and there's the fire plan. So there's 4 plans.
Right.
Because somehow, when we talk about cost containment, if we could get some information, that maybe we could explore some possibilities to try and contain some of it. I know the healthcare, I think we could shut the elevators down when we come to this meeting, and that'll help people.
Then there won't be a quorum.
I think that'll get us in shape pretty quick up and down those
See you on
stairs.
the
I'll go for it.
See you on the 5th floor.
You're gonna get to go up one, huh? 4 to 5. So with the, with Tom, I don't know, we want to send this, I mean, we're gonna approve this, but to send this to ERC for this review that we need from these other departments? To figure out what we can do, because we've been talking about containment, and obviously, they've done something that seems to work, and I don't know how we can copy with the insurance to try and have some similar results.
Mr. Chair, I have a question before we.
Oh, I'm not done yet, I'm not
Oh,
done yet.
okay.
The other question I have, is there a benefit to include specific list of healthcare options in the Department of Water and Power labor agreement if they prevent competitive bid process? So while we put this in, we can't do competitive bidding. What's the benefit of that? It's embedded in that.
There's no benefit in that.
So
Other than
why was
stability.
that done?
Why was that done?
I mean, it doesn't help us try and contain costs when it's embedded in a contract that's a multi-year contract. And should we instruct the CAO to report to EERC about the alternatives to this method of providing specific healthcare contractors in the labor agreements with DWP? Does anybody else have this embedded in the contract, or are they all separate?
The police contract has, they're not designated by carrier name, but they're designated by provider. So, the health plan provided by the relief associations, that's that's embedded in our fire and police contracts.
But that goes out to bid?
But yes, they have, though, they are not then further precluded to selecting companies that are identified in the MOU. So they have a little more, they have no flexibility. Fire and police have a little flexibility, and the civilians have the most flexibility.
Paul?
Well, I think you're asking essentially the same question I was going to ask, which is, why are we just approving these contracts for continued healthcare services, not going out to RFP and trying to
Well,
bid this competitively?
what they explained is that it's embedded in their contract. If you want to explain it to the council member again?
These specific plans are embedded in our labor agreements, and it doesn't lend for us to go out for competitive bid if these are the only ones that we can have at this point in our contract.
Is there a reason why our labor unions want to embed existing carriers rather than competitively bid these?
I personally do not have the history of how this got started. I would have to find out why it was, negotiated that way. I'm not sure.
I would think as we're trying to save money in every location in city government and avoid taking our shortfalls out on our employees' hides, we'd want to be paying less for health care and not disadvantaging our employees. So I don't see how that would be advantageous to them to embed a contract and not allow it to be competitive.
And we also have contract language that does establish a joint healthcare committee within our department, so we do have the ability to go back and meet with them and discuss with them what our future options can be.
But that would take effect 4 years from now.
We can reopen to discuss certain.
I'm just thinking to assist the employees at the same time, not bankrupt the system. So that's.
So these
the balance.
contracts, are these embedded in it for at least 4 more years?
Yes.
So Tom, we need to, through EERC, and if we carry this through with whatever memo, to have that discussed at EERC on the contracts.
The opportunity to discuss this issue at EERC would be to provide instructions to the CAO and to the Department of Water and Power on options to consider as it relates to their joint committee on the healthcare plan for plan design changes for future years.
Okay, that'll be,
I have a
Direction.
question, Councilmember Zine, in regard to the bidding process within the contracts. I understand that these carriers are embedded within the contract such that you have to use those particular carriers. But is there anything in the language that prevents bidding amongst those carriers such that one carrier could perhaps outbid, so to speak, the other 2 carriers? And then you only use that carrier, which is embedded in the contract, as opposed to having to use all 3 or 4 or however many you have.
No, there's nothing to prevent that.
that's good to know.
Yeah. Because there's, what, at least 3 that I saw. Is it 3?
Kaiser, Blue Shield, Pacific
Okay,
Care.
so there's 3?
Healthcare plan of Nevada is obviously for our Nevada employees. And
And for what now?
For healthcare plan of Nevada is for those employees that live and reside
Okay,
in
all right.
Nevada.
Who, is that a separate, unique, or is that connected with something else?
It's separate. It's one of the contracts.
So it's they're just in Nevada? Not affiliated with any other plan? Okay.
Do they have competitors from among this list, though? I mean, is Kaiser in Nevada, for instance?
No.
No.
So what if you're in Idaho or Wyoming or New York or Chicago?
We would have to have healthcare providers. If we had employees in those areas, we would have to have a healthcare provider for them.
These are for the active employees.
Correct. And we do have retired employees, plans in front of you also.
So this is active and retired.
Correct.
And when does the current contracts expire that we're moving forward? Is there a gap or a lapse?
They will expire on June 30th of 2011. This current contracts that you have before you will expire June 30th of 2011.
So we're, the ones we're trying to cover that expired June 30th, 2010. So you're trying to get them in place before that date?
Correct.
Okay.
But the MOU goes till 2014? Okay.
Let me just ask, if these sets of contracts go into effect July 1, 2010. Is that right?
Yes.
Okay, that we can ask you that prior to the expiration of these sets of contracts that are 1 through 6, that we ask that you come back before they expire with the competition amongst the 3 firms to make bids as to the providing service for the body of DWP employees and retirees. And before we go out to RFP, I would like to see if we could replicate the process that the city did and go out to an RFQ and ask these 3 companies to tell us how we can contain costs, and then how we can also add preventive health care measures into the plan that they're gonna bid on before July 1st of 2011.
And actually, our consultant, Mercer, which is the same consultant that the city personnel department uses, we do send all of our providers as part of the renewal process, the requirements that we're looking for. So we certainly can, in those requirements, state that we use certain.
But I think what was helpful to us when we were in this committee and we dealt with personnel is that we were gonna go down the process. When they put an RFQ out, people that we least expected that applied said, here are some ideas. And then we took all those ideas and plugged them into the RFP and came up with a better RFP to bid on. And so that's what I'm trying to see, that we can kind of guess what's out there, but if the people in the industry believe they have a shot at the contract, they may come up with some ideas that make our RFPs better. And then when we go out to RFP amongst the 3 companies before July 1st of 2011, we can include all that into the RFP guidelines so they can all compete for it.
Okay, I just want to make it clear, it's not an RFP process because those are the 3, not in the tradition of an RFP
Well-
process as we know it, but we certainly, when we send renewal notices to those 3 healthcare providers, we can have that information.
Well, I don't know the right term, but the issue is, what I think we're looking at is that rather than come back next year and just say, let's renew these 3 groups and this is the dollar value, what we'd like to see is the 3 groups have been given guidance as to what we want, and then they come up with some competitive responses as to how they can provide the service. So whether it's RFP, whatever the term is, that's what we're trying to get to, so we can say Kaiser bid A and Blue Cross bid B, as opposed to them sitting there idly saying, we'll just keep raking this money in because we all have a piece of the action. You might find that one or the other or the 3 might overall have a better deal than the 3 collectively.
I understand.
Okay.
Looking
Whatever
at-
we call it.
Looking at is there any subsidy? There's a subsidy, obviously. The employee, is there a copay by employees on these health plans and dental plan? Or is it fully subsidized?
No, it would only be subsidized up to the Kaiser.
No, I understand it. When you go to the doctor, though.
Oh, if there's co-pays, yes, there
There
are
are co-pays?
co-pays for each of them. I'm not sure, I don't have the co-pays in front of me, but there are co-pays.
Looking at the individual plans, Health Plan of Nevada, it states the rate increase from the previous year's rates, 13% for active and 27.7% for retired employees.
Big time.
That's huge. So on the health plan from Nevada, if you're active, it's gonna be a 13.3% increase and a 27.7% for retired. And the estimated cost on that is $74,000
For active.
and $742,000 for retired. And then on the second one, Pacific Care, that's going up 6.5 for active and 3.4 for retired. And they are talking about $11 million increase and then $80.7 million. And then on Kaiser, where you mentioned your numbers, 3% for active, 5% for retired, that's going up. Active employees, a cost of $46 million and 27 million. And on Blue Shield, that's going up 10.3 for active and 10.2 for retired. 20.9 million.
Jesus.
And then United Concordia, what is,
That's the
Dental.
DHMO, dental.
never heard of that, Concordia. So that's the only dental plan you have?
No, we also have Delta Dental, which is a PPO.
That's not listed here. What?
Number
That's
number-
for
number
retirees,
6.
only have United Concordia.
Okay, that's 7% increase for active and no increase for retired, 2.2 million. Oh, there's Delta Dental. Okay, Delta Dental's going up 13.6 for active. So Delta's only for active, not for retired folks?
Yes.
13 points, so that's a huge, $5.1 million. So what's the total package? Have you added up the millions for the 1 through 6? Huh?
197.5.
197 point.
For all 6 plans?
For all 6 plans?
Yes.
We're thinking about giving you back the transfer to cover this.
Almost 200 million.
Just joking.
So, when you're talking about our Kaiser plan, comparing apples to apples, oranges to oranges, our increase compared to their increase. But if you count the other plans, some of those other plans are skyrocketing to outer space. Okay, so let's, as you mentioned, well, we need to have CAO, CLA, bring it forward.
In terms of the plan design.
Yep.
We should take the issue back to ERC and secure instructions on considering plan design in conjunction with the CAO and
You got that, June?
assistance as well.
I figured you'd capture that. Anyway, it's a costly operation, to say the least.
Could I ask, when you come to council, if there's a couple of things you can provide us? I'd like to see on that, when you mentioned the history, how did we get into that embedded operation? So we get some explanation on that. And then also, if you can give us the 10-year trend line of cost overall, and the list of wellness programs that are currently within these 6 plans, or whatever, I guess the dental plans wouldn't have it, but the list, I think, is 4 plans. And then I'd ask, one other thing is that prior to coming to council, I believe that, when is that meeting, the joint meeting?
We meet Thursday.
Thursday. If your department could attend, could they attend that meeting?
Sure.
Attend that meeting just to see what the city is doing as it relates to trying to contain costs? Because some of these are the same providers that you're dealing with. And then we could have maybe some answers to where did any of that conversation impact the decisions before we have to vote on this? Okay.
We're trying to do is save jobs, and the more money we spend, the tougher it gets.
I just don't know how you could continue to maintain a $197 million increase over a year and then come back next year and have to do it again. I don't know when they schedule it. That's
We'll wait
well-
till you
well
get the
beyond my-
answers.
That's well above my pay grade.
We'll get, once we get the answers, is it going to another committee, or is it the only committee? Goes to Budget and Finance? Goes to Budget. Goes to
Did
your
we get
committee.
this one? I thought we only got, no, 7,
No.
only 7.
All right, it's not gonna go. So before we send it to council, let's get the answers to the questions, please, and then as soon as we get that, we'll schedule it for council.
Yeah, I can coordinate that with the department.
We don't wanna hold up the plan for the employees, active and retired, but we wanna get the answers so we'll be able to take care of the rest of the budget that we need to address.
And then we'll add in that report those instructions about next year.
Okay?
So basically, what you're doing is approving the matter, asking the department to have the answers prior to council consideration, have the ERC instruction, and a report back prior to July of 2011.
That's right.
Right. Okay, that's agreed with my colleagues and I, so that's the approval on that matter. Thank you. Number 7, please.
On item 7, what you have before you is a mayor communication along with draft ordinances. And this has to do with the implementation of various actions that are needed to transfer Environmental Affairs Department functions, funds, and staff to other city departments to restructure the delivery of environmental protection services in the city. This matter is also referred to budget, and I believe they're going to consider it next week.
That's right, should be on the 24th? 24th.
Gentlemen, go ahead.
Good afternoon, council members. My name is Romel Pasquale. I'm the interim deputy mayor for energy and environment. And today for your consideration is the mayor's transmittal for the transfer of functional authorities of the Environmental Affairs Department to three departments, including the Bureau of Sanitation, Building Safety, and to the Department of Transportation. And these functional transfers also include the authority of what the Environmental Affairs Department has been doing based on ordinances, as well as the functional transfers of the employees themselves. Before you are the ordinances that would effectuate the change, as well as ordinance that would effectuate the change in transfer of personnel. And I'm here to answer questions, and joining me is Greg Kettles, who is our counsel, who would help work on the ordinances with the city attorney.
So how, with the transfer, are we gonna be losing employees, or are we gonna increase number of employees?
No, we're maintaining the same number of employees. The transfer to sanitation will include about half of the department, which would work on brownfields redevelopment, trees, Greenville business certification, green hotel certification. And then the enforcement piece that we have, which is the LEA, which is a state delegated program, will move over to building and safety. And the air mobile source reduction funds, the personnel and the function would move to the Department of Transportation.
Is it,
And
go ahead, go ahead.
and so in terms of the number of employees, I think currently it's in around 22 employees. There is, that's around 22 employees.
So 22 staff will be moved to those other departments. Special fund or general fund?
Special fund.
All of them?
Sanitation special fund, the mobile source for Department of Transportation special fund, the LEA authority is a reimbursement from the state and Department of Waste Board.
Okay.
State, so it's reimbursed.
So basically all 22 special funds from some other source other than general fund?
Right.
And what about the administration of environmental affairs? What's happened to those folks? General manager, assistant general manager, et cetera?
The general manager it will be moving over to work with the Department of Transportation to work on special projects as well as the mobile source administration. The assistant general manager will be moving over to the mayor's office and the establishment of the mayor's office of energy, environment, and sustainability as the director of sustainability. Those are the two management positions.
So what have we accomplished, other than eliminate a department and shuffle bodies? We haven't
Well,
eliminated anything.
We've moved folks off of the general fund. We've essentially consolidated the functional authorities of environmental affairs into appropriate departments, which include sanitation, which would then leverage their other functions in recycling and some of the green building work. So there would be some synergies there. With respect to the LEA authority, if you recall, the LEA authority had been bouncing back and forth for the past decade. And it had been in planning and moved to environmental affairs. And the reality is the synergies with building and safety, because they are inspectors themselves, have a good match here. And then the air mobile source reduction has a fit with Department of Transportation because of that vehicle miles reduced.
So as far as savings, we haven't really saved any money. All we've done is transfer the bodies and use the other funds to pay for them.
But yes, and we've moved them off of the general fund into the special.
That's what I'm saying. We've taken them off, but we still have the same number of employees, and they've gone from general fund to special fund. But other than that, we haven't accomplished anything on this shuffle. Correct me if I'm wrong.
No, I'm wondering if from a budgetary savings perspective, we have saved the general fund from a functional
No, we haven't.
So they will still be maintained in the different,
So all we're doing is we're paying for them out of a different pot. It's approximately 900,000 annual savings to the general fund. So the general manager who was with Environmental Affairs, are they still gonna maintain their general manager's salary, or is that gonna be adjusted?
I believe that it went through
Yeah, where I rated it.
It was already? The assistant general manager too?
No, that.
Oh, that's right, I remember that, I remember the general manager, okay, I remember that one. Okay, and, why the planning department and CDD were not included in the final recommendation for transferring environmental affairs functions? Why not, why didn't anything go to planning or CDD?
Well, we, in terms of the function, when we looked at the functions in planning versus the functions of environment, specifically with respect to sanitation, there was much more synergy in sanitation, particularly with a longer history in environmental protection. When you look at stormwater protection, when you look at recycling, you look at green building to some extent, both of them have roles. Planning's role in environmental regulation and oversight is really on a kind of planning basis. So the functional authorities of environment and other cities landed in public works or sanitation context. So there was more synergies there.
Okay.
And so the CDD function, the two folks had voluntarily transferred to Department of, to DWP. So there was no functional transfers there.
Okay. Paul?
Yeah, it sounds like if I hear what you're saying, that most of the savings were from transferring people from general funded positions to special funded positions. Did we actually need to blow up this department to do that, or could we have found a way to do that within the existing structure?
Yeah. Well, we also were responding to the FSR that had been laid out that had the original movement of folks from EAD to planning. My sense is that it could possibly happen, but the way that it was outlined was that the closure or the elimination of the department was necessary in order for folks to be moved into those different departments for funding purposes. The special funds that EAD had were very few and limited. They were very, very limited. So there was not a special funding categories or sources for EAD.
So any way we could have saved those same monies without dismantling the department? Because I had some real questions about whether any of our grantors might have viewed that as a lowering of environmental priority by eliminating an environmental department. And so if we were able to save through another method, it certainly would have been preferable to blowing up this department.
I don't think there could have been. There's always a possibility, and this was a very challenging decision that the mayor and his staff had to make, and some of the consultation was made with the environmental community as well. What would be best for the environment in the context of LA and the discussions with environmental leaders. And I can tell you that many of the leaders in the environmental community supported this concept of moving folks over into, or functions over into the appropriate departments, and then creating the Mayor's Office of Energy, Environment, and Sustainability. So that, while it may appear on paper that it minimizes or reduces our commitment to the environment, it actually elevates it in some respects, and makes it more functional in others.
So you're saying by and large the environmental community bought into this change and thought it was a decent idea?
Yes, they did. We had conversations with them. I've had conversations with them. So this was not an issue that raised that level of concern about whether this minimizes LA is coming into the environment. It's actually made the environment a little more focused for them.
That's very good to hear. I didn't realize that. I think that's a good bit of information. Thank you.
Brian?
Let me ask Pete. Yes, let me ask, if this item is going to Budget and Finance and we're going to try to get it in council soon, are we going to have those ordinances that go with the documents?
Yes, particularly if there are no changes or
Okay, so-
amendments, we can finalize the ordinances very quickly and get it to council at the same time.
Same time we schedule?
Or we'll work with the clerk.
It's scheduled on
Being scheduled.
Okay, so-
Even if there are amendments, if they're fairly small, we can incorporate those.
If I understand it, to get it on agenda next, we've got to schedule it by Friday?
It's because of the 45-day period. So the 45 days is going to be next Friday, so we want to schedule for
Or earlier than Friday, earlier than a week from this Friday.
next Friday, yes.
That's not a problem.
Okay, all right, we're set on that.
You'll have it in budget and finance on Monday.
Monday, the 24th, I think it is.
Do you want to review it, or do you want to wave it through?
No, we got some issues that,
So we'll wait until the conclusion of budget and finance, and then if there are any amendments, we'll incorporate them, transmit it. If not, we'll go ahead and transmit
okay.
it.
Yeah, because we want to just take a minute in budget finance to make sure it's consistent with what the budget committee did, and we haven't had that opportunity. But let me just ask you a question, and this is what we asked you during the committee, and it still is a concern, is that, yes, we've moved some of these functions to sanitation, we've moved some to transportation, the mayor's office has some, and also building and safety. But where it appears lacking, and I don't have a comfort level yet, is the coordination. And having used environmental affairs, where they take stuff off of you, it's not where you would go to 4 different departments and say, is it you, is it you? You'd give it to them, and they would pull all this together, whether it was relationships with the state and county or whatever. That's where I'm having difficulty, because you can give functions away, but you can't put coordination on an organizational chart. It just kind of happens, and that's where the missing link is for me.
And I heard you in the previous committee meeting.
So you'll have a better
In
answer
terms
today?
of- I'm sorry?
You'll have a better answer today?
No, it's not a better answer today. I just, I think the coordination role, I mean, I look at it as being twofold. One, I think the bulk of the functional kind of policy work of the environmental affairs department really fall into sanitation. Because you've got the enforcement piece, which is a very finite role that building and safety will play. That's a fairly clear, they can only do so much.
That's right.
The rest of it falls into sanitation, which is most of the potential EIR issues, potential contamination issues.
Is that where the
around
grants
those
are?
sites, and that's where the grants are. So you've got sanitation as a place to go on that particular piece. So in terms of comfort level, where one goes, since there's no EAD, I think sanitation offers that kind of comfort.
Let me just say, having been here a couple of minutes, is that the issue that we run across when you split up responsibilities into 4 ways, everybody walks up to their line. When you really get stuff done is when people bridge the line to get it done. And while 4 people might say, this is mine, and I don't do that other stuff, that's what falls through the cracks, because there's no one coordinating it. And you mentioned that the mayor's office is going to assume that. And again, I just have to say, we've not had the same success of coordinating things in the mayor's office as we do with departments. So that's a big issue for me, that we can go and they could say, we've done grants, we've done our part, and then you say, well, what about this? Well, I think that's over in building and safety. I think it might be in, it puts us all in a position to where you're searching for the answer until somebody steps up and says, I'll take that ball and run with it. It's not mine, but I'll do something. That's what's missing.
Yeah, and I completely appreciate it and understand it, because having worked in both high levels of federal and state government on environment issues, you do need that kind of
That's
role.
right.
And I agree with you, and I think this is where we have an opportunity when we establish the Office of Energy, Environment, and Sustainability to really work with council on this particular piece. Not only because it's necessary, but I think it's very mindful, because there are going to be some issues that fall into, that are geographic specific that we haven't considered, that are community specific that we haven't considered. And I think that the coordination role that we have in our office really puts folks that holds departments more accountable. But I think your issue of how do you get to that one person that's going to make sure that that one issue, or 2 issues, or 3 that council members and community actually get dealt with, I think that can be hashed out as we roll out this office. I really do, because seeing how other cities have operated, having a separate department has not always been the most effective. Some folks have moved it over to the city manager's office. So we were looking at different models.
Because I think that our history has shown when it's particularly complicated, some piece falls out, and all of us assume it was done. And 3 years later, you find out that piece never got done because it never was tagged as a part of a larger. That's the big issue, and we'll ask you Monday the same thing. Give you practice.
Okay, so we're going to adopt the recommendations contained in the mayor's transmittal and transmit the final ordinance.
So basically, you're happy with the ordinances that have been presented in a draft form?
We're accepted it.
Okay.
I mean, I will say, for the
Wouldn't say we're
record,
happy, we're accepted.
for the record, I never thought this was a great idea. Obviously, Councilmember Parks has some concerns as well, so hopefully, by the time we complete this process, we have more of a sense that we really are accomplishing everything that this department was accomplishing. Because I have those same concerns that the balls could get dropped and we could lose grants, other things could go wrong, that for the minimal amount of savings to make this change may not be worth it.
Ms. Gibbs?
Sir, just for the record, we asked that the CAO take a look at the draft ordinance. I think there were some tweaks that the CAO may be suggesting to the city attorney. So I didn't want to give the impression that the committee should be adopting the draft ordinance literally as presented. What we would like the committee to do is to instruct, or excuse me, we don't instruct the city attorney. We request the city attorney to transmit the ordinance directly to council when it is scheduled, but for them to work with the CAO's office to ensure that the concerns that they have will be incorporated into the final version that's being presented.
Okay, that's not the notes I have, but if that's fine with me.
Okay.
Fine with the committee?
Sure.
Okay, great, thank you. 5 to 3, we're adjourned.